Good afternoon, everyone. Welcome to PWPL Presents Community Conversations. Today we're joined by Dr. Jennifer Dehlin from Singletrack Health. Thanks for joining us to talk about telehealth.
Good afternoon, Jenny. Thanks for inviting me.
Yeah, so your office transitioned to telehealth pretty quickly after COVID-19 hit the state of Michigan with the first case. Can you tell us about that transition?
Yeah, so before this all started, we were actually out of the area, as many people were with, spring break plans. And pretty much immediately after arriving home, and this was the first week of March, it became clear that we couldn't do things the way that we had been doing. A typical workday for us was seeing people in our clinic, pretty much back to back all day, either with 1, 2, or 3 providers in the clinic. So it was a pretty busy workday. And back then, what many of the clinics were starting to do is to ask people if they were ill, ask them to come alone to visits, have alternate plans for sick patients. But within the first 2 patients of my morning, it became clear that it really wasn't going to work to do that, really the symptoms of the illness were varied enough and overlapped enough with enough other medical problems that we just weren't going to be able to screen people appropriately to keep people separated between themselves and my staff. And then really it was either later that day or the next day, the government actually relaxed some guidelines that had prohibited us from using telehealth in the past. And what those were that previously telehealth could only take place in physician shortage areas. And as much as sometimes it seems like it is, Marquette is actually not a shortage area. And then also previously, the telehealth call the patient had to be at a telehealth site, so they couldn't initiate the call from their home. They had to be at a central site that was designated as a place for telehealth calls, like picture kind of an empty office suite in a clinic or a hospital. But clearly that would defeat the purpose, because then you were taking that person out of their home. So with those guidelines relaxed, within an hour or 2, we figured out that our electronic health record actually had a telehealth module that we just had to turn on. Cost a little bit of money, as anything does, but we were able to do that and train ourselves to use it that afternoon and then start using it the next morning.
Wow.
But starting to use it is a lot of pieces. So our telehealth module runs through a physician portal, which requires the patient to do some steps on their end to gain entry to the portal. And we see people of all ages at our practice and all skill levels when it comes to information technology. So that was a really labor-intensive process for our front office staff to teach people the steps that it would take to use that portal. And also kind of to help them understand why, if we thought that this crisis was going to last a week, 2 weeks, 3 weeks, we could have just rescheduled everybody. But the further we got into this, we realized that unfortunately, life is going to be different for a long time or maybe forever. And so with that in mind, we really felt like we couldn't just reschedule people or put people off, that we were going to have to start engaging with them to address their health needs the best that we could.
And how's that going? I mean, you've said you've already started using it.
We have.
What's that look like?
I think as of Thursday or Friday, between myself, my husband Chris, and our partner Will Barker, we had seen 420 patients over telehealth. And those are our patients at Singletrack, and that represents about 1/6 of our total panel. So really, it's quite a lot of people. One thing we learned pretty quickly is that just using the one platform through our electronic record really kind of didn't cut it, because everybody had their own limitations as far as whether they had a laptop, a tablet, a smartphone, what type of browser they had, could they change it, could they activate their microphone, their video. And in the end, we alternate between 5 different platforms in order to communicate with people. We use our health portal through the EMR. We sometimes use Zoom that the 2 of us are using. We use a product called Doximity, which is a HIPAA compliant app, which works by me sending you a text message and then you click on it to activate a link. We have had some people even use, we use FaceTime sometimes if people have an iPhone. Or I even used Facebook Messenger Live with one of my 98-year-old patients because that's what she uses with her great-grandchildren, which was kind of fun because then I could learn a little bit more about her from her Facebook page, like that she went to Calumet High School, which I did not know.
Wow.
So
That's incredible.
you have to be just kind of adapting again to what skills people have and what hardware people have. Because really what we learned pretty quickly is the video piece is important. A lot of what we do in a visit can be figured out based on the clinical history, based on a discussion, but having that video picture, it's really the picture tells 1,000 words. And part of it is in the interaction when we're getting the clinical history and when we're explaining the advice that we have, that, you know, we check for understanding based on what the patient's face looks like. And then also as part of our physical exam, you know, I mean, through the limits of the cameras, we are able to see things and we're able to hear things and we're able to look at that person and use our, you know, I've been a physician since 2005 and I can leverage my, you know, 15 years of practice to, in a few seconds, look and say, this person looks sick or this person looks well, and then frame our visit. So if we have to, we'll just do a phone call because we do have some patients that all they have is a landline and then that's all we have. But really, if we can make a video happen, we do, because it gives us so much more.
Okay. So you answered quite a few of my questions. Thank you.
That's because I read them ahead of time and I
prepared. That's nice. So how are you, if you do need things that can't be done over a video, like labs,
Sure.
or if somebody breaks a small bone that your office could handle, how are you dealing with that?
So we have a couple different options. So first of all, some visits right from the start, you know, you can't handle over telehealth. An example would be a boil that needs to be drained. Someone like that, we know that we need to take care of it in person. And then, so in person, we have 2 different options. Some things we're taking care of in people's vehicles in our parking lot. So it depends on where that boil is. If it's on your arm, you could probably put your arm out the window and we could handle it. But if it's on your bottom, then you need to come upstairs. If we're taking care of you in the parking lot, we'll have one provider that's dressed in appropriate personal protective gear, head to toe. If you're going to come into the building, then we have all of our staff that's in the building, and it's less staff than we normally have. We have other staff that's working from home. We have them covered appropriately, and then the provider that's going to see that patient, again, is in appropriate personal protective gear, and we ask that the patients that come in wear a mask. And we're lucky that we're in a building that has, you know, one front door that you open, and then after that, there's no doors that you need to open. We'll have them open for you. You can come right back into an exam room so that not a lot of things get touched, because after you leave, then everything's going to need to get wiped. So the majority of what we're doing is telehealth, and then each day we usually have some visits that are taking place in the parking lot, and usually 1 or 2 people that are coming into the office. And again, that's a procedure that is urgent. Think the skin abscess, or a broken bone. So we have casting materials that we use for something that needs to get taken care of, or a laceration, or some of our OB patients to we've needed to kind of tailor obstetrical care. ordinarily obstetrical care is kind of a recipe for just about everyone. We have a schedule where we do the exact same thing on the exact same schedule through the pregnancy. But because of this, we've really had to put together a personalized care plan for each of our obstetrical patients that basically leverages, okay, what is that person's skill set? You know, what can they do at home as far as self-monitoring? You know, do they know how to check a blood pressure because they used to work as a nurse's assistant? Is that something that they can do for themselves at home? And then some checking in with them over telehealth. And then, you know, for what services do they need to come into the office? And we're trying to consolidate those services at the office. For instance, you know, I have a patient coming in next week. She's 28 weeks pregnant. And at that visit, she has a certain blood type, so she requires a ROGAM shot. So we're going to give her that. And then around that time, we do gestational diabetes screening. All of you ladies out there, I'm sure remember drinking the yucky orange drink. Well, normally we have people do that at a lab, but because of this, I don't want people going to a separate lab. So she's going to come to our office, drink the orange drink, sit there for an hour, and then we're going to draw her blood to check. We got some phlebotomy supplies from the UP Health Systems Marquette. And so we're able to draw the blood ourselves in the office and then send that in. So we have to dust off some of the skills we haven't used since medical school.
It sounds like a lot of catching up on skills, technology.
It is.
Yeah. Seems like it's a moving target, all of it.
It is. You know, some people kind of get frustrated by seemingly mixed messages from healthcare providers and from government. It seems like we contradict ourselves, but the answer really is this is a moving target. And what we think is the best thing today is going to be different than what we might think next week. And that's been the same, that's been that week by week. Right now, we're kind of settled into a pattern. And again, our practice procedures are what I just described to you. And we're going to be able to, or we're going to need to do that through the end of the month. But then it's going to depend on what the governor's new orders are and then how the situation evolves in our community.
Right,
you know,
because you were mentioning that if you could explain for people, I know I did watch the Ask the Doctor episode with Dr. Piggott and yourself and Dr. Chris about that Marquette County really hasn't had any community spread yet. So and he recently released a report that we read that saying, you know, we might be behind in lower Michigan, more of the denser population areas, and us really having a peak here. So can you talk about that at all as a professional?
Sure. Yeah. You know, we all started doing the things that downstate was doing when they started doing them. And as a result, we have kept our community spread here to a minimum. You know, most of our cases here in Marquette County are isolated to a few hotspots and some travelers back into the area. But, you know, we're not seeing the spread person to person that has happened in the cities. But what we're seeing in other states is that really over time it spreads from the cities to the suburbs and then ultimately to the rural areas. And then, you know, meanwhile, what's going to happen is that the restrictions are going to be lifted from us. So then what happens from there is going to really depend on what our community does. You know, the worst case scenario is we forget all of this happened and we go back to being crowded together, close together, not covering our coughs, you know, being in large groups. If we went back to that, you know, some of the data really shows that this could be devastating for our area and will overwhelm our health system. If we can be prudent in what we do, then it's going to temporize this. I would love it if we never had the community spread that the bigger communities have, but I think it would be foolish to think that that's the case. And instead, we have to prepare for that. And each of us as an individual and myself as a business owner, we need to think about how we can protect our friends and neighbors. And so really that's going to be, you know, continuing these changes that we've made to protect each other for a longer period of time. So, you know, you guys, people may be asked by their doctor or their hairdresser or the owner of their favorite bike shop to do things differently. And we need to do those things. We need to think about how we can interact with each other less, because this is not the short term.
Right. And I feel like, it's really a shift to interacting with each other in a different way.
Yes, because it's sad not to interact at all.
Right.
It's really sad.
Yeah, it's hard.
We have to have that social time, that personal connection, but we're going to have to be creative about that in order to keep each other safe.
Right. I didn't ask you about your staff. So we've heard in a lot of instances that some doctors aren't working, some nurses who work in areas that on floors that don't need their assistance aren't working. Can you talk about, is that happening in Marquette? And how is that affecting your office?
Sure. So, my husband and I own this business and we employ our friends and family. And so when this started, my goal was, number one, to be able to continue to take care of my patients, and number two, to be able to take care of the friends and family that I employ. And so we made a commitment not to lay anybody off or reduce hours. In order to do that, the Dehlin household, we're eating a little ramen right now. but that's okay. Again, we come third, but we are lucky in that we were able to pivot our business to be able to continue to take care of our patients safely and to be able to do enough of that to cover our payroll. Some people's practices are doing that is trickier. And, that would be the specialty providers in our community that have, more of what they do as elective work. And by elective, I don't mean unimportant. I just don't mean, life or death, or however you want to put it. Some of these things are very important, but people are choosing not to do those things right now. So I think as those specialty providers need to probably work on what they can do to continue to serve the needs of their patients, short of, the things that they're limited. We're limited, for instance, is, nobody's doing joint replacement surgery right now. To do that, it requires bringing people to the hospital and using a lot of the personal protective gear that's needed for taking care of the people who are sick. But those same providers do take care of those same problems in different ways. And that might just be some reassurance or a consult with somebody. I have patients that I'm seeing in my practice that have medical problems that need some attention from a specialist, and they can put that procedure off, but they could benefit from consultation. So some of the specialties are, and I'm hopeful more specialties will come online with providing some type of service in another fashion, like telehealth.
Yeah, and I guess time will tell how long this goes. They might decide they need to.
Right, and that's going to just depend on how things evolve, and how good we are at changing the way that we do things in order to allow people to seek those services safely.
Let's see, I think I've asked just about everything. We're kind of asking all the people that we interview how the library can help with community healing and recovery as we come out of, as we're looking forward to coming out of a stay-at-home order, what our role can be as a community center.
Sure. I think all of us need to think about fundamentally what do we do and how do we continue to do each of those functions, and our library is part of the heart of our city. It's a gathering place for people. It's a place that facilitates meetings. It's a place to come for information. And so I know you guys are looking at each of those facets. How do you do that? How do you continue to provide information, by doing things like interviews with people that are disseminating information, and, maybe facilitating some groups or other ways for people to meet. You and I know how to use this technology, but maybe others need help or training on how to do a meeting over Zoom. And then, how do you access some media? Just like we had to help our patients learn how to access a medical visit over computers and smartphones, then maybe the library can work towards educating people. Okay, how do you access your favorite audiobooks or your favorite visual books and music and things that you can use on your device?
Yeah.
That's my thought.
Yeah, those are great ideas. I know we've been talking about those same things, as how to create some of those videos to help people or talk them through it. Yeah.
Yeah.
Well, is there anything else? Go ahead.
No, I guess the last thing I was going to say is, one thing that myself and my partners have been thinking a lot about is just, us as a medical resource in a general sense. In addition to the one-on-one service that we've always provided our patients, we want to be a resource in the community to kind of help others open up in a safe manner. So we're thinking about how we can reach out to other businesses like the library, and be a sounding board or a consultant on, how can a person run their business in a safe manner when it comes to infection control. So we're happy to be that resource to try to help other business owners to help our patients.
Okay. And if anyone's interested in that, should they just contact your office?
Yeah.
Okay. So I didn't ask you. That sounds like one more thing, and it sounds like you're learning so much. Like, how are you and your partners and your staff doing? It sounds like a lot of work.
It is a lot of work, but we're all right. When you have a common goal and everybody's working together, it feels pretty good. So we've been lucky that we have a really good team here, and everybody knows the mission and knows that we take care of our patients and we take care of each other. And so things have gone pretty smoothly, actually. And we've even had some nice fairies that have helped us out. Today, some nice people brought us lunch and a bunch of candy from Donkers.
Wow.
So
that's great.
Yes, I felt very lucky today.
Yeah, awesome. Well, thank you for joining us for Community Conversations, and we'll look forward to hearing good things in the future, and we just appreciate your time.
Thanks. You too, Jenny.
Okay.